The dreaded colposcopy and the pain that it causes. You all hate it. Many of you have been through it. And you're wondering, should we, your OBGYNs, be doing better in making it a more comfortable process? Hi, I am your local OBGYN. I love women, so let's talk about it. Analgesia, or pain control in gynecology, is having its moment. Why? Because we women have been told to suck it up, buttercup, and just kind of like handle the discomfort. And it is pretty rough going for some people. But let's give due diligence to this conversation. And some women do just fine with nothing because they just have a different pain tolerance. But the reality is that, should it be on the menu of options when you go in for a colposcopy? Yes. And what is the menu of options that you can ask or request? So the standard of care right now is that most colposcopies are done with nothing. Now, if you level up one, you're talking about doing Excedrin or Motrin or something like that, naproxen, maybe an hour before so, as a dose to help with some of the crampiness. Off-label use, you can use either a topical lidocaine spray or gel and put it on the cervix. The data is sort of mixed on this one. Some studies show it's kind of helpful. Some studies show it doesn't really change too much of anything. And there could be some placebo effect that goes into it. If we take it a step further, some people are just like super duper nervous, and we get that. And maybe they need something like an anxiolytic, something that's going to help with their anxiety so that they feel calmer going into a very nerve-wracking situation. But if you do that, you usually have to have a chaperone take and drive you home, because these things, when you take something like a Xanax or an Ativan, you cannot drive. It's a bad thing to do. Alternatives beyond that are injections. Now, you can actually get your cervix injected where the biopsy is going to be done. However, I will tell you as a provider, it is something that a patient will feel. The injection does have a sting to it because you are getting a needle in the cervix. And then there's all this good idea that we should all be doing anyway, which is coaching, positioning, telling people that want to know what's going on, telling people that don't want to know, distracting stories to get you to the other side of the procedure. Insurance is usually not so helpful in covering these in an OR, but some will consider it. The question is always, what's going to work for you? And have you been through one of these procedures with or without anesthetics? And what would you prefer?